Hello, everybody. I'm so happy and grateful to be with Dr. Clifton Meador. And he's an incredible person that I'd like to share his story and his books with you. Dr. Meador is he's a professor emeritus from the Vanderbilt University. And he's been practicing for 60 years, and he's the former dean of the University of Alabama at Birmingham. Welcome, Dr. Meador.
Thank you. Looking forward to the talk.
Yes, thank you so much. So let's just cut to the chase, because I have your bio down already, and you just have I could talk forever about what's on your bio, but you've written 15 books. Can you tell me, what did you write in those books? What was so important to you?
I got fascinated early on in my career in the early 60s with patients that had diagnoses of diseases they did not have, had a false diagnosis. So when
You
I went
wrote a
back
book on that, right? Did you write a book on that? Do you have that to show us? Oh, thank you. Symptoms of Unknown Origin. Yes, tell us about that. Yeah.
That book gives my accounting of about 200 patients who had diagnoses of false diagnoses. And I raised the question, if they don't have a diagnosis, what is the cause of their symptoms? They have symptoms, but they don't have a medical diagnosis, don't have a medical disease. So there are causes for symptoms that are not diseases, named diseases. For example, I had a Crest toothpaste diarrhea, I had a blue cheese.
Crest toothpaste? Crest? Okay.
Crest toothpaste diarrhea. It took about a year to figure that one out. It takes a long time to figure out these hidden symptoms. It takes a lot of listening, it takes a lot of diary keeping.
Wow.
Is it something eating, breathing in, some substance? Is it some toxic relationship? Are they inflicting themselves with disease? Or is disease just a kind of a way of life, a pattern of living? Some patients just like the secondary gain of illness.
Right.
They're difficult to deal with. So about half of patients coming into primary care do not have a medical diagnosis. They have symptoms, and they have causes of those symptoms. It takes a lot of listening. We're not doing that anymore. You're down to 8-minute visits. You're down to the MRR. All these tests are constricting the time. So there's simply not enough time in primary care. That's the fault of the doctors giving into that. They need to insist on time. They need to insist on being paid for that time without having to increase the visits just to get money. It's a money-driven system now, and that needs to stop.
Okay. Wow. I wish I had that book in medical school. Maybe that's something that residents and medical students should read, if not practicing doctors.
The other thing I wrote was, you asked me about books.
Oh, yeah.
This book here just came out last week, and it's the 4th edition, really, of these rules. I have 365 rules on how to practice medicine.
I actually got that book, by the way.
Yeah. Okay.
I love that book. I wanted to, in fact, I'm just looking through my notebook here. I wrote down a couple quotes, if you don't mind. Can I ask you about what so there's one area, so I have the other version of it, I think it's a gem. It's a gem for doctors, not just for leadership, but how to treat patients. And on number 200, you said the medical school curriculum is a poor format for learning anything about life. Can you tell us what you mean by that?
The curriculum is centered on organs. You study a lot about the details of how does it function, what does the disease of that organ look like, what are the symptoms that come from that organ. You don't study the mind at all, or how people think or live, or what I call the lived life of a patient or person. It's completely divorced, so you end up a very good scientist, but a very poor psychologist, very poor listener. Is not taught. There's no reward for listening in medical schools that I know of. So you end up a very one-sided person. And I think part of that explains the high suicide rate, the high addiction rate, the high divorce rate of physicians. They just are not exposed to how to live a life.
That's so true. I was thinking about that. There's something that came out of the Mayo Clinic saying that when we give the tools to physicians to understand leadership and how to lead themselves, the physician burnout rate goes down and the professional satisfaction goes up. You also said, just because you know a lot of physiology, biochemistry, and anatomy does not mean you know anything about life or people. Let your patients and other people teach you. Is that
Right.
what you meant also?
Yeah, I think if you learn to listen, which is an art form, I'll get off into that in a minute. If you learn to listen, you're going to learn from patients as you see them. You learn something from each patient. What were their faults? What were their, how did they screw up life? How did they do well with life? All of that. All of that goes back to that dualism of mind and body to Descartes in the 1600s, where he, in order to get around the Catholic Church, said the mind belongs to God, it can't be investigated, and the body is a machine that can be investigated. That dualism permeates Western medicine completely. You've got a mind and a body, and they're completely separated. So in medical school, you either taught about the mind as a psychiatrist, psychologist, or you taught about the body and not connected. Actually, the body and mind are not separated at all. One affects the other and the other affects the other. They're back and forth. And learning how to delve into those factors that are generating disease of the body takes a lot of listening. A friend of mine said, whatever the mind cannot process is relegated to the body. If the mind can't handle it, it goes into the body as a symptom. And that's a very powerful statement.
Very powerful. I totally understand that. And that's why you feel all the stress, anxiety, and fear is related to how you not being able to control what's going on in your mind.
Right.
Right. And then I asked you also, I asked myself when I was looking this book about how did you become a great leader? Do you think it's these principles, or where did you learn that
About
from?
the time I was coming along, the Markle Foundation gave these scholarships to people who were going into academic medicine. And I won one of those in 1963, and it paid $6,000 a year, which could be spent any way you wanted to. It was a free grant. So I went to Harvard for 3 months. I went to California to spend time with Carl Rogers, all kind of stuff. I got a lifelong subscription to the New England Journal with that money.
A lifelong subscription? A lifelong subscription?
Yeah, right.
I don't think they do those anymore.
I think it was $200.
Oh my gosh.
It'd be a lot now.
Yeah, I think it would be, a
So
ton.
that money allowed me all kind of experiences. Plus, the Markle scholars met every year in a resort place, and you got to know all these people. So you learn by association what leaders were like in medicine, and you slowly became one by tacit learning. We didn't have a course in it. It just was by association. You visited the other schools, they visited you. You became close friends and acquaintances with a lot of leaders and picked up whatever they picked up. It's by osmosis, I guess. I don't know.
So what would you say, that's very interesting that you had that experience. What would you say are like the top 2 or 3 characteristics of a great leader, and that you would recommend physicians now to really embrace as leaders?
Characteristics?
Yeah, like what do you think constitutes a great leader? What do they do?
I think they tolerate fools very well. I think that there are a lot of extreme characters in medicine. You have to dissociate yourself from them.
Yep.
And I know I get killed for this, but the more surgically oriented they are, the more difficult they are to deal with. Surgeon gets up in that operating room, he's king, or she's king, and totally in control, and they come out in life and think they can do that in life. Now, not all of them do that, but a number of them do. So learning to deal with surgeons is a real important trait to get, and it takes listening and patience, and not involving yourself in the conflict, staying free of the conflict, listening to it, trying to help with it, trying to understand where it comes from, and being supportive. Mainly requires listening and trust. Developing trust and how to develop trust is the key, I think.
So how do you even change your personality to be like that? Is that possible? I mean, I know I did it, but it took a long time. I was probably that person you're talking about. Um,
Michael Ballant wrote a book called The Patient, the Doctor, and His Disease. And he
uh-huh.
says to be a successful doctor, drug as a doctor, requires a slight but definite change in personality.
Hmm.
I think that's true whether you're a leader or just a physician. You have to change from an ordinary personality to this healing, trusting kind of personality where emphasis on being helpful.
Right. I mean, to me, to get to from that person you were talking about, that surgeon, because I'm an interventional radiologist, I do some surgery, but I used to have that top-down approach to leadership and upset people and think that they just have to deal with it. And I think for me, I had to learn to who I was first and my awareness of me, and then I can start listening better, and do better. What do you think of that? My self-image had to change.
Don't you think some of that comes from modeling the professors that taught you?
Yes,
You're
definitely.
imitating some of them, and they have the same problem they have addressed. So
Yeah. Thank you so much. That's a great. And the only thing I would have to say is about you mentioned spending time and listening to patients in order to make the right diagnosis, especially when you have symptoms of unknown origin. How do we do that in this day and age? We don't have the time that you may have had in your time. I mean, with EMR and all this, administrative work, and we've kind of lost control as physicians in our field. My goal is to try and regain some control. What do you think about how we're going to do what you're asking us to do?
that's a really tough question. The whole system is turned into a money-driven system. There's a book called Money-Driven Medicine by Maggie Meador, worth reading, of how the system has shifted from healing to making money. There's no system out there that's clinically designed. I'm hoping it will be, in which the system tells you what to do clinically and then figure out the money. Doctors have just got to stand up to the hospital administrators and these system administrators that insist on high volume pass through because it makes money. It generates false positives, it generates harm, it actually generates more cost because the patient is shoved up into specialty care prematurely. So the doctors have got to stand up and insist on some sort of financial system that does not purely reward volume.
Right.
Salaries would take care of it. A well-negotiated salary would allow you to spend whatever time you need to take care of the patient. Some patients require a lot of time.
Right. I think if we go to salary, then there's got to, not only does it have to be a salary that's agreed upon, but then we're going to have to do something about the cost of medical education, which is, there's no way I would be able to pay off my debt if I was making a lower salary.
Right.
Right. So I think
Maybe,
all of that comes hand in
maybe
hand.
it's going to take a union. Maybe it's going to take some of
It,
the organized effort like that. I don't know.
yep. But the Mayo Clinic and the Cleveland Clinic, they basically have doctors on a more salary type of,
Right.
and it seems to really work. So
So
thank you so much for this call. Did you have one last word to say?
no, just learn to listen. That's all I know to say. Repeat myself.
Yeah. And one
I,
last thing, how do you stay so vibrant and active? I don't know how old you are, but you
I'm
seem to be
about to,
at it still.
yeah, about to be 89. The,
Oh, wow. That's amazing.
one thing is I'm emotionally immature.
Is that the secret?
No, the secret is exercise. Exercise, exercise, exercise. Every day, you got to spend an hour a day exercise.
All
I
right.
think that's the secret. I don't know.
Well, thank you so
I
much.
don't feel 89, but I am.
You look great. So
Thank
stay
you.
healthy and safe. And thank you for sharing your books. How do people find out more about you on the internet?
Just Clifton
You have
K.
a website? You have a website?
Webpage is www.cliftonkk.com. Clifton K. Meador, M-E-D-O-R, MD.com.
Okay, I'll post that too. Thank you so much for
That's good.
having this chat today.
Thank you for having me. I enjoyed it.
Thank you very much. All right, I'll end this recording now. Thank you.